G'day guys, my name's Aaron from Vector Health. I'm one of the physiotherapists here. Today we're just going to go through some taping options for both the knee and the ankle. Start with the knee. So options of tape, got rigid and dynamic. So rigid tape, as the name suggests, is rigid, it doesn't move. So just tear this up a little bit. As you can see, trying to pull that, there's no giving it. But when we come to the K-tape, you'll see how much stretch there is. So for a knee tape, there's a couple options you have, but generally there's a good just general knee support tape. So what you want to do there is wrap up and around from underneath the knee. So to begin with, you can get your hyperfix. This tape, the glue tends to be a little bit more gentle on the skin. So if skin is a little bit sensitive to things like band-aids, even certain types of bandages, whatever it might be, this is quite good to use underneath. Also for you guys, if you've got hairy legs, hairy arms, that sort of thing, the white tape is also good to use. I mean, girls, if you've got hairy arms and legs as well, do it too. If for whatever reason the tape isn't sort of sticking, you can also get some adhesive spray. The adhesive spray can also act as like another sort of layer for the skin too, and protect the skin that way. So then you can get sort of a double sort of protective layer before the heavy stuff goes on. So let's get to it. We'll start with the white tape. We start with 2 anchor points going around the leg. So one above, one below. What that's going to do is just going to allow the tape to stick on a little bit better, hopefully not lift up so much, and then just generally last a fair bit longer without wanting to lift up. Try and be smooth through the tape. You know, if there's a couple little bumps here and there, that's fine. But if you're finding it's pinching up halfway through, it's probably best to just redo another one. Not that it's going to change anything for the actual tape in terms of what it's doing, but it just gets irritating wearing long pants, tight shorts, whatever it might be. And we really want to try and just reduce as much irritation as we can, particularly up in these sort of climates in the tropics. It gets a little bit humid, gets a bit sticky. People tend to sweat under things a little bit more, and it can sort of get into the skin a fair bit more. So really important to keep in mind of any sort of skin irritation sensations. So whether that's itching, burning, sort of tingles, ants crawling around over the skin, all that sort of stuff. If you are getting that with your tape on, take the tape straight off. The action of tape isn't sort of beneficial enough to warrant any sort of skin irritation. So what I'm doing here, I'm coming from the inside of the leg, I'm wrapping up underneath the kneecap, and I'm adding a slight sort of scooping pressure underneath the kneecap. I'm trying to lift it up just a little bit. With the white tape, you don't need to do it quite so much in terms of pull just yet. This is just the underlay, okay? Just to protect that skin a little bit more. Alright, so now we start with the rigid tape. So the rigid tape can actually be a little bit hard to tear. The best way to tear it is if you go really sort of tight pincer grip, grab with the nails and tear hard. The slower you tear, the harder it becomes. Bend your nails up, it gets pretty uncomfortable. Same again, trying not to have any or too many creases going through there. As you can see, my first attempt at that round wasn't the best. You do, with the anchors, want to wrap the whole leg up, just so it goes around the whole way, so it's a nice strong anchor point. So this sort of tape, when would it be good? A lot of you runners out there, this will be quite good. A lot of sort of landing type sports as well will be quite good. Also, if your knee's just a bit generally achy, this will be another one. Sort of instead of having to wear a compression bandage or anything like that, this tape can be easily substituted out. Granted, it's not a fix for swelling. Swelling, you would still need that compression, but this is good, just providing that little bit of extra stability through the knee and a bit of extra support. So this tape, hold it down the bottom, get a good inch of tape down on the leg. From there, you're going to hold it down and you're going to add that pressure up as you lay it down. So you're pulling and twisting, trying to scoop that kneecap. Then you do the same thing on the other side. Can also be a good idea, the back of the tape, line your tape up if you haven't done too many taping jobs before. Just a nice easy way so you're not spending or wasting too much tape and then having to buy roll after roll after roll, because nobody likes that. So same again, got about an inch of tape down, hold it down, give it a good tension up and over. We're trying to scoop that action of the knee. Finally, 2 more anchor points go down just to hold those pieces of tape in. And that is a general knee support. Things to be aware of, making sure these points aren't cutting anything off. Are they too tight for you? No. So things also you want to be careful of in sort of the first 24 to 48 hours after taping, particularly when it goes around a whole leg. Make sure there's enough circulation in the toes and the feet. So what you can do, if I could get you to pop your shoes off so we can look at your toes. Hopefully the toes aren't coming off. That's alright. So what you do is you just pinch the toe, it will go white. See how long it takes to get that pink coming back through. You want to be within 3 seconds. If it's not within 3 seconds, sort of 3 to 4, keep an eye on it. If it's anything over 4 seconds, probably best to go to your doctor. Or take the tape off at least anyway, straight away. If it's then not coming back sort of within half hour or so, might be an idea to run to their doctor and just get them to check it out, make sure the blood flow is all okay. Also pins and needles, numbness, fiery burning, any sort of that nervy type pain, you also then take the tape off, take off the pressure, and then maybe try again in a couple of hours time after that, those sort of symptoms have settled back down. So that's a good knee support for rigid taping. So then we can also use the dynamic tape. The dynamic tape is stretchy. This tends to be a little bit better for your more dynamic sports in terms of running, change of direction, having to get really low to the ground where you have to really sort of stress this joint, but you still need a little bit of that support coming through. So what you can do here, you keep the exact same support up from under the knee, but then what you can also do is get a bit of tape, sort of 6 to 8 inches across. You're going to be coming across the kneecap, alright? So you find the top, find the bottom, should be a little bit squishy underneath, a little bit squishy on top. If you go the rest of the way through and it's nice and hard, that's your kneecap. You're going straight over across the top of that. A tip for dynamic tape, round the edges over. What that does is it just stops it from catching on clothes, putting pants on, that sort of thing. Just helps it last a little bit longer. The rigid tape usually lasts sort of up to 3-4 days, depending on how your skin's going underneath. It's hard to check that, but often people can sort of just feel how that's going. The dynamic tape does actually tend to last a little bit longer, but it loses the stretch. So after the first sort of 24 hours, about 50% of that stretch is gone. After that, it just keeps losing more and more stretch. So sort of 3 days is the most you would wear the dynamic for. So what you do here, pop a good inch of the tape on the inside of the leg, right in line with the kneecap. What that does is it allows the tension point to come back towards where there's more tape on the leg. Okay, so what you do from there is add it from the outside of the kneecap and push in, and then drag the tape up and over. Doesn't matter if you go down on your finger, you'll be able to get that out of the way. And then hold down with about an inch left of that tape as well. Get your finger out from underneath, and then pop that tape down. Again, a little bit of a fold is okay. Anything bigger than that fold, you'd probably want to redo anyway, just because that's going to get a little bit frustrating on some pants. But what that will do, you leave a bigger non-stretch part of tape on the inside of the knee, so the tape wants to pull to that gradient point. Never any more than 50% of the stretch on the tape as well. That's just going to stretch the tape too much. You still want it to be able to recoil back into itself. So that's then another good way to add dynamic tape if you're needing to bend that knee a fair bit more. So that's knee taping, guys. If you have any questions or anything like that, you're always welcome to call up or pop in and have a bit of a chat. If you are getting knee pain, taping isn't something that you should be relying on. If you're having to spend rolls and rolls and rolls of tape to keep yourself going, might be an idea to come in and get things checked out. There might be something a bit more happening there. Sometimes it's just a bit of muscle activation or something like that. Doesn't always necessarily mean there's something serious going on with the knee. If you're having to rely on tape to keep you going, pop on in, we'll have a look, see if we can stop you having to spend rolls and rolls of tape on yourself to keep yourself going.